Greetings, everyone, and welcome to the Golden 30. My name is Carrion Gray. I am the Adult and Senior Services Specialist for Prince George's County Memorial Library System. And once again, welcome to the Golden 30. The Golden 30 is a 30-minute program series geared to older adults that is available by phone and online. You can access 24/7 by phone at 240 455 5460. That number is once again 240 455 5460. This month, we will discuss supportive care with Patricia McMillan, who is the Director of Medical Services and Chesapeake Supportive Care for Hospice of the Chesapeake. Welcome, Patricia. How are you today?
Thank you. Thank you for having us. I'm great. How about you?
I'm good. I'm good. If you don't mind, give a little background about, I guess, how you got to do what you do at Hospice of the Chesapeake.
Okay. So I was a hospital executive for years and took time off to raise my family. And then about 11 years ago, had the wonderful opportunity to work for hospice. And because of my background, we at that time decided that we were going to start a practice, a medical practice, and Chesapeake Supportive Care is the medical practice of Hospice of the Chesapeake. And so we have nurses, nurse practitioners, physicians, coordinators, schedulers, managers. I'm the director, and we have a census of about 1,000 patients a day.
Wow. Wow. Can you give us a little bit more information about Hospice of the Chesapeake?
Sure. Hospice of the Chesapeake is a nonprofit organization that helps patients and their families who are experiencing serious illness. We provide care in 3 counties, Anne Arundel, Prince George's County, and Charles County. We have treated more than 30,000 patients in our lifetime. We started about more than 36 years ago. And we are a multidisciplinary team. We have physicians and nurses, CNA, certified nursing assistants, social workers, chaplains, counselors, and volunteers. And we treat or we care for patients and their families. We have a Chesapeake Life Center, which is our grief and counseling center. We have 2 inpatient centers, which are those for those patients whose symptoms can't be managed at home. They come to our facility here on campus, and then one in Charles County. So we have been part of the community for a long time, and I know that there are many, 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 many people who are grateful that we're here.
Thank you for that. Thank you for that. Now let's get into it. So today we're talking about supportive care. Right. So what is supportive care?
Supportive care is a specialized medical care that focuses on patients who have serious illness. We look at how this illness affects the whole person, not just physically, but spiritually, emotionally, mentally. And we work with patients to identify and manage the symptoms that result from their illness, with the overall goal to help people have a better quality of life. It's often referred to as palliative care, and that can be confused with hospice. And so in January of this past year, we changed our name from Chesapeake Palliative Medicine to Chesapeake Supportive Care. supportive care and palliative care mean ease, and that's what we try to do, is to ease the suffering of patients with life-limiting illnesses. It's not to be confused with hospice. I always say that hospice is palliative, but palliative is not hospice. Supportive care is appropriate for any patient with a life-limiting illness. We really ideally would like patients referred at the time of diagnosis. But so, for example, if somebody was diagnosed with cancer, that would be the ideal time for them to refer to us. And the beauty of supportive care is that you can also receive curative treatment at the same time that you receive supportive care. So a cancer patient could still receive chemotherapy, radiation, renal patient could still have dialysis, those type of things. So that is very much different than hospice. So that's really what we are, and what we try to do is to ease the suffering of patients with life-limiting illness.
When you say life-limiting illness, I know a lot of time when people think of hospice, and just to clarify for people, they think of, oh, this is end of the life, this is where somebody goes to die. And when you talk about like curative treatments like chemotherapy and things like that, is that really the difference? Or can I guess you expound on that a little bit?
Sure. So we would like to think that supportive care is upstream from hospice. So there's a criteria that many providers use, and they say, would you be surprised if this patient passed away within 6 months of life? And if the answer is no, that's a hospice patient. That is a patient who is really at the end of life, who is no longer seeking curative treatment, really wants to be comfortable. A supportive care patient, if you use that same criteria, is any patient who a provider would say, would you be surprised if this patient passed within the next 12 months or longer? So we're considerably farther upstream than hospice. Does that help?
Yes, thank you. I think that helps clarify things for people. I know that there are a lot of myths about hospice anyway, but I think you really clarified what supportive care is. Now, in that same vein, why should an older adult consider supportive care?
So supportive care should be considered by older adults because they can help focus on their goals. Everybody has certain goals that they want at the end of life, or not even at the end of life, but when they have an illness. What is important to you? Some people, it may be, I want to stay home and play with my grandchildren. Other people, it might be, I want to go to every Ravens game that home game. So everybody has different goals that they want. And this helps people focus on those goals and gives them a quality of life, not only quality, but quantity. There's a lot of research that indicates that people that go on supportive care may live longer than if they didn't have that support. Life is uncertain, and illness affects all of us in one way or the other. And so supportive care can help the patient and the family cope and move on until however long they have, whether it's 2 weeks, 2 months, 2 years, whatever.
That's good to know. Now, how do you go about assessing supportive care?
So, so somebody that was considering supportive care, many times providers, their primary care physicians or their specialists would bring that up in conversation. But if not, the patient or the family can certainly bring it up to that provider. We do need a referral from a primary care provider or a specialist for us to see the patient.
Okay. So now tell me, what makes up the supportive care team, or who makes up rather?
So we are really an interdisciplinary team. We have physicians, nurse practitioners, nurses, chaplain, social workers, and there are other disciplines that can become part of the team if it's appropriate for that particular patient. But we, for example, if the patient is having physical therapy or occupational therapy, they may be also a part of the team. But we're very cohesive, and we collaborate with each other and with the patient's doctors out in the community.
Okay. And what medical conditions, I know you talked about like supportive care, but what medical conditions qualify and benefit from supportive care?
So we care for patients with many different illnesses, but they may include congestive heart failure, COPD, cancer, chronic kidney disease, chronic liver disease, strokes, ALS, dementia, Alzheimer's, Parkinson's disease, any disease that may limit someone. I always use the word life limiting, just limits what you can do in life if you have something that's kind of holding you back.
Okay, that's interesting. That's a wide range of illnesses.
Sure.
Now, how do you pay for supportive care?
So supportive care is a specialty, just like a medical specialty, just like your oncologist, your pulmonologist. And so it's a fee for service. Those older adults that are on Medicare, Medicare Part B pays for the supportive care visits, just like they would another specialty.
Okay. Now, can you still get curative treatment for life-limited illness with supportive care?
Absolutely. That's one of the benefits of supportive care, is that it goes hand in hand with other treatments and interventions. And it really allows for an extra layer of support for the patient and their family as they navigate these illnesses. So like I said before, patients that have renal failure, they can have dialysis. Patients who have cancer can have chemotherapy and radiation. Any definitely concurrent care goes along with supportive care.
Okay. Just curious, what surprises, I guess, your patients or family members or caregivers about supportive care?
What surprises?
Yeah, like what are people usually surprised by supportive care?
I think they're surprised at number one, that they can continue to do all this concurrently. Number two, our visits, they're not like a standard medical visit. Our visits have an average of 73 minutes per visit. Additionally, we see patients in all types of homes, basically where they reside. So if a patient is homebound, instead of them coming to us, we come to them in the 3 counties that we serve. We go into nursing homes, we go into assisted living facilities, we go into hospitals, we go into a traditional home. But we will come to you if you are homebound and just can't get out any longer.
That's good to know that it is adaptive in that way. Now, I guess that kind of answers my questions. Where do you go for supportive care appointments? But are there special places that they go, or you kind of follow people?
So we have nurse practitioners that are in nursing homes that actually have a regular schedule, and they spend days in the nursing homes, in the hospitals. But we also have two um, centers, one on our campus in Pasadena and one on our campus in Charles County. These are called the Hussman Supportive Care Centers. They were um, built from a generous donation of the Hussman family. And so that is kind of like a doctor's office. Those patients that are able to come and, travel, or a loved one can bring them, they can come to our centers.
Okay, wow. And how does supportive care help with advanced care planning?
So advanced care planning is probably one of the most significant focuses of supportive care. And, people don't really want necessarily to sit down and talk about the things. Do they want to be resuscitated? What types of intervention they want at the end of life? These are difficult conversations, but this is really a gift that you can give, that the patient gives themselves and their families. If you have plans in place and family members who honor those plans, there's really nothing, you can go on and have a quality of life and enjoy the things that you want to enjoy. So they think about these conversations. Can be one conversation, they can be multiple conversations depending on the family dynamics and the patient's wishes and goals. And the advanced care planning ensures that the voice of the patient will be heard when the patient is no longer there. So it's, I would say that advanced care planning and symptom management are the two focuses that we have in supportive care.
Oh,
We want
wow.
to make people comfortable, and we want to have people's wishes and goals put down on paper.
Great, great, great. So do you help, I guess, coordinate some of that or provide resources to them or referrals of any sort?
For advanced care planning,
Yes.
well, yes, we have, there is something called, there are books and there are forms for uh, putting down your wishes, and so yes, we can provide resources, but really what it is it's conversations. It's really talking through these these questions, and the exploring all the concerns and all the options, um, and those are not, they're not etched in stone. I mean, they can be reevaluated and readdressed as the patient's health declines or changes, but it helps put down what the wishes are of the patient, and so there's no question at the end.
Thank you. That I think that gives great clarity on what it is, having that conversation. And we know that sometimes going through it, those conversations can be difficult to have. So that's good to know that that is also provided with the supportive care. I see that there's a term called primary complex illness care.
Sure.
And how can that help with an older adult or
So
someone?
there are many people that, especially older people, that may not be able to get out of their homes as easily as they once could, and so we now will provide primary care along with supportive care. So we can take over those primary issues and prescribe primary medications. Now, certainly this is with the blessing of the patient's PCP if they have one. We find sometimes that a lot of older people don't have PCPs. They don't have primary care physicians. So we can assume that role. And it's really for patients who are homebound that just can't get out, and the care is managed just like supportive care by a physician or a nurse practitioner. Will come out, and then if there's needs in the interim between visits, we have nurses, the triage nurses that will take the calls and kind of direct the patients, and if they need a visit, we'll go out and see them. For example, now we are giving flu shots to our patients. We have given the COVID vaccines to our patients. So we have we have two excellent nurses that help triage in between the providers' visits.
Thank you for that.
Mhm.
And I also thank you, Patricia, for taking the time to elaborate on what supportive care really means. I don't know if you have anything else that you want to add to that.
The one thing that I would add is that if somebody does have a life-limiting illness or something that just is making their life a little bit more difficult, or was just recently diagnosed with cancer or COPD or CHF, consider supportive care, because we provide an extra layer of support. We provide 24/7 somebody you can call, somebody you can talk to, and assure you and reassure you that things may not be the way you think they are, and kind of maybe adjust meds or do something, but it's 24/7 extra layer of support that we can give patients who are living with serious illness.
Once again, thank you so much.
You're welcome. Thank you for having me.
No problem. And we also want to shout out and thank Hospice of the Chesapeake for allowing you to come in and just helping to inform people. If anybody wants to get more information, I encourage everyone to visit the Hospice of the Chesapeake's webpage. It's hospicechesapeake.org. They also have a toll-free number, which is 877-462-1101. If you want to take a look or listen to more of their services and what they can provide, or if you want to read up on more information. Also, I wanted to encourage anybody who is homebound you can still be connected with the library. We have a books by mail program that is free for any Prince George's County resident who can no longer access the library due to a physical disability or vision impairment, where you can get books by mail for free. Also, we have tons of ways to connect online, from movie streaming services to music streaming services. And we also have resources that really tell you about stuff that you might be interested in, whether it's AHFS, Consumer Medication Information. That's part of our EBSCO databases, which is a trusted source for patient drug information, and it's available in English and Spanish. We have Health Source, the Consumer Edition, which is access to nearly 300 consumer health periodicals, including American Fitness, Better Nutrition, Fit Pregnancy, Harvard Health Letter, Men's Health, Prevention, and Vegetarian Times. So, and then even if you are into nursing, we have the academic edition, which provides over 550 scholarly full text journals focusing on any medical disciplines. To check those resources out, please go to our website and connect through there. It's pgcmls.info. And we thank everyone for tuning in. If you have any questions, once again, visit our website. Thank you and goodbye.